Have you ever wondered what the most painful injuries someone could sustain are? Or maybe you've had one of the following injuries and thought, this has to be the most pain anyone could ever experience. Were you right? Well, brace yourself, because these injuries coming up are not for the faint of heart. Over 30 million people visit the emergency room each year due to injuries. And of these 30 million, many of them will have one of the following 7. But let me just get out ahead of something before we jump into this list, because I learned my lesson when I did this video here. Pain is different for everyone. One person's severely sprained ankle might be way more painful than another's bone fracture. So, with that in mind, welcome to the ER. Number 7, fractured tailbone. Breaking your tailbone, also known as the coccyx, is a pain in the ass. Literally. It's located at the base of the spine and is a small triangular bone made up of 3 to 5 fused vertebrae, which is surrounded by a dense network of muscles, ligaments, and nerves, all of which can be affected if this bone is fractured. The most common causes of a tailbone fracture is a direct fall onto the booty, especially on a hard surface. However, this injury can also occur during childbirth. As if this wasn't hard enough, the pressure exerted on the tailbone as the baby descends through the birth canal can sometimes cause this to fracture or even dislocate, particularly if the delivery is difficult or prolonged. Repetitive strain from prolonged sitting can also put continuous stress on the tailbone and cause it to fracture over time. When I was in nursing school, I didn't have a fractured tailbone, but I had been sitting for such extended periods of time studying that it became very inflamed. And when I tell you, the pain was enough to make me cry. It still gives me PTSD just remembering it. It was enough that I had 0 issues carrying a donut around to sit on everywhere I went. And then finally, another possible cause of tailbone fracture is a direct blow to the back or buttocks, such as in a car accident or contact sports. And the thing about this is there is no way to hold the fractured tailbone in place. Sitting down will be painful. Having a bowel movement will be painful. Sexual function can also be affected. Swelling and bruising can also occur. It plays a key role in supporting your weight, and any pressure on it will aggravate this injury and cause persistent pain. The healing process isn't a walk in the park either, because this area receives less blood flow compared to the other parts of the body. So the recovery process is slow. Number 6, torn ACL. Ah, yes. You knew knee injuries were going to be on this list. And ACL stands for anterior cruciate ligament. Anyone who's had this probably doesn't need me to expand on this pain any further. The ACL is situated within the knee joint and it runs diagonally through the middle of the knee. It connects the femur or the thigh bone to the tibia or the shin bone. And as the name suggests, it's located at the front part of the knee, and it crosses in front of another ligament called the posterior cruciate ligament, or the PCL, forming an X shape. Its main role is stabilizing the knee and preventing the tibia from sliding out in front of the femur. It helps control rotational movements of the knee, especially during activities that involve turning, pivoting, or sudden changes in direction or weight bearing. So let's paint a scenario for this injury. A hockey player is on the ice and ready to face off. He leans forward, preparing to move quickly, and hears a pop, followed by sudden intense pain and then swelling soon after. His knee immediately feels weak and keeps giving out as he tries to skate off the ice. Well, this exact scenario happened to my son, Tyler. This was him. And one of the tests for this is called the Anterior Drawer test, where the examiner sits on the foot of the affected leg to keep it from moving and pulls the shin bone forward. If it slides out like a draw, It's positive. Do people say draw or drawer?
Oh, well, that's a great question.
I keep saying draw, but I know I get made fun of all the time. So is it draw or drawer? Put it in the comments. Treatment typically involves a combination of surgical and non-surgical approaches, depending on the severity of the injury, your activity level, and your overall health. And a short distance downward from the ACL sits the next injury on this list. Number 5, Achilles tendon rupture. The Achilles tendon is a strong fibrous cord located at the back of the lower leg, and it connects the calf muscles, or the gastrocnemius, and the soleus to the heel bone, or the calcaneus. This tendon is crucial for walking, running, and jumping because it allows the foot to push off of the ground. A rupture of this tendon occurs when it's overstretched and tears, and this can happen due to a sudden increase in stress, such as sprinting or jumping, explosive movements like pushing off and pivoting, falling or tripping, leading to awkward landings or direct trauma. And it can also happen over time due to age or overuse. And, little fun fact, as a side effect to the antibiotics Fluoroquinolones, such as ciprofloxacin and levofloxacin or Levaquin. It's weird. If you're curious about this, I talk about it in this video. So it often feels like a sudden sharp pain or a snap, and some describe it feeling like they've been kicked in the back of the leg. And when it ruptures, the ability to push off the ground is severely compromised, making walking difficult or even impossible. The back of the ankle and the lower leg are also rich in nerves and blood vessels, making it particularly sensitive. And the response to the injury naturally leads to inflammation, tenderness, and the added benefit of muscle spasms. Now, in ancient Rome, if a slave tried to escape and was caught, punishment included having the tendons in the back of the leg severed, including the Achilles tendon, which would then cripple the slave and prevent them from trying to flee again. This was also called hamstringing and is horrifyingly barbaric. Researching this actually made me a little bit nauseous, I'm not gonna lie.
Do not do.
Treatment consists of rest and immobilization with a cast or brace, allowing it to heal. Physical therapy to restore strength and flexibility, pain management, and sometimes surgical repair if a person is really active or it's a complete rupture. Now, while this is very painful, still not as bad as the next one. Number 4, broken ribs. So I've had broken ribs recently. I tripped over the dog while holding things in both hands, and rather than dropping them, I decided to fall straight forward, landing with an incredible force directly on my chest. Oh my God. You know, clearly I'm using a teleprompter, and I'm getting a call from my electric company letting me know that they're coming to read my meter. And because I have a dog on my property, they're just letting me know. The issue with this, JCP&L, is they'll continue to call because I haven't actually picked up the phone. I just keep declining the call. So, really aggravating. Anyway, yes, I fell straight forward with just an incredible force on my chest, and I broke 2 ribs. And this was by far the most painful injury I have ever had. Breathing was a minute-by-minute struggle. The slightest movement reminded me that they were broken, and it took a good 3 months before I could go a day without feeling some type of twinge. But still, if it's humid or if I move in a weird way, it's there. We all know that the ribs expand and contract with breathing. And when they're broken, this movement causes the ends to rub together against each other. Coughing, sneezing, and laughing results in enough pain initially to make you want to pass out. The ribs are surrounded by a network of nerves, including the intercostal nerves that run along the bottom edge of each rib. And when one is fractured, these nerves are kind of pissed off. And this leads to just an intense pain. So rest is crucial to allow time to heal, as really with any fracture. And while it's important to avoid deep breaths that cause pain, continuous shallow breathing can lead to other complications like pneumonia. So gentle breathing exercises will need to be done a few times a day. Applying ice to the injured area can reduce swelling and numb the pain, and in some cases, the chest might be wrapped to provide some extra support. But again, this is done cautiously to avoid restricting breathing too much. But yeah, this was a little slice of hell. However, if broken ribs are a little slice, then the next one is the whole pie. Number 3 are femur fractures. The femur, or the thigh bone, is the largest and strongest bone in the human body. Breaking it typically requires significant force, which then often results in severe trauma to the surrounding tissue because of this bone's rich blood supply. So when it's fractured, a substantial amount of bleeding within the thigh cavity causes swelling, bruising, and additional pain due to the pressure that this causes. The sciatic nerve, which runs very close to the femur, can also be irritated or damaged. Not to mention that the muscles in this area, the quadriceps and the hamstrings, they can spasm afterwards as well. Any attempt to move or bear weight on the affected leg is a hard stop. Do not pass go, do not collect $100. The most common causes of this injury are motor vehicle accidents, falls, and sports involving high speeds or significant physical contact. Under normal circumstances, it takes approximately 1,700 to 2,200 pounds per square inch, or PSI, to break it. To give you an idea, the bite force of a large crocodile can be around 3,700 PSI, but smaller species can exert a bite force of around 2,000 PSI. So yeah, wrap your head around that. I had a really good friend in high school that broke his femur while skiing. Not actually even while skiing. He fell off the chairlift from a decent height, and yeah, it was, and this is another scenario that makes me a little bit nauseous just remembering it. Tony Hawk in 2022 had a femur fracture, actually femur fractures. He had broken his right femur in 2 different places, trying to land a McTwist. Most femur fractures will require surgery to realign and stabilize the bone, including intramedullary nailing or inserting a metal rod into the marrow canal, and then using metal plates and screws to hold the bone fragments together. This is better known as an open reduction internal fixation, or an ORIF. After it's healed, long-term recovery includes extensive rehabilitation, with patients typically needing months of physical therapy to regain full use of their leg. Now, all of these injuries up to this point have been equal opportunity offenders. So what do I mean by that? Well, let's move on to the next one, and you'll understand. Number 2 are penile fractures. So going into this one, I might have to get creative with explaining the mechanism of injury with this one. I'm sure most of you can pretty much figure out how this happens.
Dude, is she for real?
But, you know, I always have to be mindful of, like, Josh sitting in some back room in YouTube and hearing me say penis too many times and hitting the demonetization button or whatever. It's happened. I mean, we're all adults here, and I happen to be a healthcare professional who appreciates the human body and doesn't get wigged out by body parts and their proper names. So with that, enough of my rambling. Just read between the lines in some of this. Okay. Most people associate a fracture with the bone, which is why there have been misconceptions that the penis contains one. Hence the multitude of slang terms for an erection, if you catch my drift. But in reality, this is traumatic injury that occurs when there's a sudden forceful bending of an erect penis, and it causes a tear in the tunica albuginea, or the fibrous membrane surrounding the corpora cavernosa, which are these two cylindrical structures that fill with blood during an erection. So what exactly happens here? The most common cause of penile fractures is vigorous sexual intercourse. You can probably surmise the mechanics of this injury again. Part A slips out of Part B, but due to inertia, is forcefully thrust into a nearby hard surface, causing it to bend abruptly, leading to rupture. An audible pop or snap is often heard at that moment, causing an immediate loss of erection, and blood from the ruptured structure leaks into the surrounding tissue, causing significant internal bleeding and swelling, or better known as a hematoma. There's severe, sharp, and rapid swelling, and the penis often becomes bruised and discolored, frequently even turning a dark purple or black due to the internal bleeding. And like all so far, this is a very serious injury. Immediate medical attention is crucial, and it's considered a surgical emergency to prevent complications such as permanent dysfunction or penile curvature. Surgery typically involves making an incision to locate and repair the tear and to drain any accumulated blood causing the hematoma. Post-surgery, men will need to avoid sexual activity and prevent the flag from flying for several weeks to allow for proper healing. But just when you might have thought that I was done highlighting the most painful injuries that are specific to men, we have one more left, and this is numero uno. This is the Mount Everest of injuries, the Mac Daddy of pain. Number one, testicular torsion. So this is another medical emergency, but here, the spermatic cord twists and cuts off the blood supply to the testicles. This is also known as ischemia, and it leads to a lack of oxygen and nutrients, causing the tissue to start dying. And this leads to excruciating pain and possible permanent damage if not treated promptly. Now, causes of this can be due to a congenital abnormality, as some males are born with a condition called bell clapper deformity, where the testicle is freer to rotate within the scrotum, making torsion more likely. Trauma or direct injury can also cause this, where fast movements can sometimes trigger torsion, as can the rapid growth of testicular tissues during puberty. So the testicles are rich in nerve endings, making them highly sensitive, of course. When the spermatic cord twists, the nerves in the testicles send intense pain signals to the brain, and this is often accompanied by nausea, vomiting, and swelling of the scrotum, just adding to the overall discomfort. And aside from the symptoms just mentioned, pain can radiate up into the lower abdomen. The skin of the scrotum can appear red or dark due to the lack of blood flow, and the affected testicle may be positioned higher than usual. Immediate medical attention is crucial again. Surgical emergency. And the sooner it's treated, the better the chances are of saving the testicle. Surgical intervention includes detorsion and fixation, or orchiopexy, which untwists the spermatic cord, restoring blood flow, and then the testicle is secured to the inside of the scrotum to protect against further twisting. A lot of these injuries require surgical intervention, so click here to see my ranking of the top 7 most painful surgical procedures and my responses to the thousands of comments that I got about my ranking of them. I also want to thank all who supported Lucid Med by sending a super thanks or buying one of our t-shirts. It really, really helps me to continue making more content for you. And also, by the way, it was the channel's 2-year birthday on July 5th. And as a gift, we hit 2 million views because of all of your support. All of the views, subscriptions, likes, and comments. I will always personally respond if you do leave a comment, because this community means everything to me. You all rock. Seriously, I have the best viewers. I love you all. And now you can click here. Stay healthy and lucid. Oh my. Yeah, because I know you're going to call back 18 times. A rupture of this tendon. Here we go with the hair again. When it ruptures, the ability to push off the ground is severely. Most notable femur fractures caught on camera include numerous, most notably femur fracture. But in reality, this is a traumatic injury that occurs when there's a sudden forceful bending of an erect penis, causing a tear in the tunica albuginea. Tunica albuginea. Albuginea. The tunica albuginea. That's what I feel like I'm saying. Like I turned it to some little old Italian grandmother trying to name the parts of the penis. Anyway. Take 57. Now, like all so far, this is a very serious injury. Immediate medical attention is crucial, and it's considered a surgical emergency to prevent complications such as premature. Nope, not that complication. Testicular torsion. It's not really a torsion, but there was a story a while ago of a guy jumping a fence. It's either a story that I'm remembering, or it was one of my son's friends in high school. It might have been. It might have been one of those crazy nights at a party, and he was jumping a fence and had shorts on. And the top of the fence was pointy. And it caught and ripped.